Hi, my name is Esty Sherbach, and today we will be discussing marijuana and its impact on our physical health, mental health, and other associated factors. So, what is marijuana? Marijuana actually comes from the cannabis plant group, which comes in two different strains, cannabis sativa and cannabis indica. The primary psychoactive or mind altering chemical that marijuana has is THC. This is part of marijuana that gives people the high that they desire. In addition to THC, there are 100 other cannabinoids present in the plant. Cannabinoids are also mind-altering chemicals related to THC. Marijuana is a frequently used drug that is referenced by multiple names. You may hear people calling it weed, herb, pot, grade, bud, ganja, Mary Jane, hash, and more. Marijuana can be administered in multiple forms. The most common one is smoking the dried plant. This can be done either by crushing up the dried plant and rolling it up in the form of a cigarette or smoking it through a glass pipe. Another common way to intake marijuana is through food. This form is called an edible and can come in the form of cookies, candy, and more. Another common way to take marijuana is by extracting the wax from a plant and inhaling it through a pen, which heats up the oil to produce a vapor. Marijuana can have numerous negative effects on the body no matter what form the marijuana is taken in. These include impaired judgment, trouble remembering things, an increase in dopamine release which can heighten your sensory perception and make an individual especially paranoid about their surroundings. Marijuana also increases anxiety, enhances symptoms of depression, will produce an uncomfortable burning sensation in your mouth, and hinder brain development in a baby if the pregnant mom takes marijuana. Additional negative effects that marijuana can cause are bronchitis, a phlegmy cough, a risk of developing lung cancer, and lung irritation if the marijuana is smoked or inhaled. It can result in an accelerated heartbeat, weakened immune system, and a slowed reaction time. This can be especially dangerous if someone is driving after using marijuana. Lastly, marijuana can also cause painful withdrawal symptoms if it is used on a frequent basis. Although there are a large number of negative effects that marijuana can have on our body, it can also have numerous positive effects. It can cause an increase in dopamine release, which can make a person less depressed. It can decrease anxiety by easing the nerves. It can relieve symptoms of glaucoma, which is an eye disease caused by high eye pressure. It can increase an individual's appetite, which is important for those with eating disorders. It can reduce nausea and vomiting, which is why patients who are going through chemotherapy are often advised to take marijuana to ease the side effects. Marijuana can cause pain relief and also reduce the risk of tumor growth. So as one can see, marijuana has many positive and negative effects on the human body. It just depends on the person who is taking it and how their body will react to it. Some risks or long-term effects that come with using marijuana can include affecting our brain health by causing a permanent IQ loss. The use of marijuana has also been linked to plans for suicide, depression, anxiety, and other mental health problems. Marijuana can also reduce athletic performance by reducing coordination. Reduction of coordination is also something that can impact people who are driving under the influence. Additional risks include impacting the health of a baby if a mother who is nursing her baby is taking marijuana. THC can be passed from the mom to the baby through breast milk, which will impact the baby's brain development. Marijuana can also cause aggression and violent behavior in a person. Decreased academic performance and setbacks in a career are also risks. The last risk and long-term consequence is addiction to the drug. Some additional facts about marijuana include that it is more commonly used by females than males. It is one of the few illicit drugs that is able to be prescribed by a doctor. The medical use of marijuana is legal in 31 out of 50 states and is legally allowed to be used recreationally in 10 out of 50 states. Marijuana is the most commonly used drug in the United States, at about 70 people out of 100 reporting the use of marijuana. But just because this drug is commonly used and abused doesn't mean that it doesn't come with its negative consequences. Thank you for listening to this informational video about marijuana. If you are struggling with marijuana use or know someone who is, please call the Addiction Treatment Hotline at 1-800-662-HELP. Thank you.